Channel 9 is following several breaking developments as our community fights coronavirus.
I want to start with a new case that could have a far-reaching impact. The United States Postal Service confirms an employee has tested positive. This person works at the Mid-Carolina Processing and Distribution Center in West Charlotte. The USPS believes the risk is low for other workers, but Channel 9 is asking, did this person have contact with your mail? And a tragic development, what could be Mecklenburg County's first death inside a Charlotte nursing home. More than a dozen other residents at the Social in Cotswold are now testing positive as well. And the governor now announcing testing is quickly picking up. It's up 88% statewide in the last 2 weeks.
And in the past hour, we have learned that Charlotte-Mecklenburg police will get a 5% hazard pay increase.
They're up against the virus every day, and they're making sure people are obeying the stay-at-home order. Mecklenburg County now has more than 1,100 cases, but we also want to draw your attention to Cabarrus County, which now has 201 cases. The county's health department now says 18 of those cases came from small gatherings, including wedding and birthday parties. Channel 9's Mark Becker joins us live. Mark, the department wants people to realize that even gatherings of 10 or fewer people can be a risk.
Yeah, Phil, we've all heard about this social distancing and the importance of keeping that distance. Well, they've got a couple, exactly 4 perfect examples here in Cabarrus County as to why we should be concerned about them. The Cabarrus Health Alliance says the 4 gatherings, all within the last couple of weeks, were small enough to be within the guidelines, but big enough to start outbreaks of the virus.
We have encountered some positive cases where when we talk with them, they had very small family gatherings.
Dr. Bonnie Coyle, the Alliance's new director, couldn't release any details about those gatherings, but the county says they included a wedding, birthday parties, and an Easter family gathering. The number of people at most of the gatherings was below 10, but they were enough to lead to at least 18 positive cases of coronavirus. All of them are now in quarantine, while the Health Alliance is tracking down anyone they may have had contact with.
We're in the middle of the process. It's going well. As long as individuals listen to our message that it's really important that you stay in your house, that you do not go anywhere, then we will do well.
It's a reality check that any gatherings, even the small family variety, can launch an outbreak. You don't have to convince Shannon Dapper of that. Juvenile diabetes has weakened her immune system, and she's cautious about getting together with anyone, even her own family.
I understand. I have a brand new nephew who I can't wait to meet, but it is what it is right now.
And the health department here says they've identified 35 people at least who've had contact with those 18 who've tested positive for the coronavirus because, again, of those small gatherings. A perfect example, Phil, of how that can start small and spread very, very quickly.
Certainly eye-opening. Thanks, Mark.
And now we want to show you a wider picture of the cases we showed you just a few minutes ago. Take a look. North Carolina is pushing for more testing. Out of 73,000 tests so far, there are 5,800 confirmed cases. And in the last 10 minutes, South Carolina updated its cases statewide. There are nearly 4,100 cases, including 149 in York County. 7 more people have died, now 116 statewide. A nursing home crisis, but it is impossible to know the true extent of it without more transparency. Just look at a new example. At New York, it's now revealing a deep COVID-19 crisis at its nursing homes. 19 facilities there have each had at least 20 deaths.
Mecklenburg County has the highest number of cases in the state and the highest number of outbreaks at long-term care facilities. Yet for weeks, Channel 9's Joe Bruno has been asking where those facilities are, even as recently as last night.
They have not responded to my questions asking how a large outbreak is defined. But you can be sure this is something we're going to continue to stay on top of.
Rowan and Cabarrus counties have all informed the public about specific local outbreaks. I want to bring Joe in now. Joe, you've been pushing for this relentlessly. Now your efforts could be gaining some traction?
Yeah, I got a message this morning from Mecklenburg County saying they're going to provide additional information on these outbreaks today. Now, I still haven't gotten that message just yet, but I have been able to learn some more information about some of the outbreaks we are seeing in Mecklenburg County. We'll start with the social at Cotswold, where we saw people entering the assisted living facility with protective gear on and masks. I broke the news about the facility telling family members a resident has died due to COVID-19. 14 other people who live there have tested positive. 2 staff members have also coronavirus. I also broke the news about cases at the Pavilion Health Center in Ballantyne. We learned today 11 residents and 2 staff members have tested positive. Unlike neighboring counties, to this point, Mecklenburg has not been transparent about cases at nursing homes. County commissioners say it is a good thing that is changing.
It's where we need to go, and I am appreciative of the coverage that it's been getting through the news, because really I think it's only reasonable that families are concerned. It's only reasonable that communities are concerned, and I think that providing more information is the way to handle it.
A staff member at Aldersgate has also tested positive for coronavirus, but I'm told the risk to the rest of the facility is low because they were very proactive in getting their residents to isolate a week before the mandate. Back to you.
So much concern for loved ones in those facilities. Thanks, Joe. North Carolina now has outbreaks in 35 nursing homes and 11 residential care facilities. That includes at least 67 cases at Five Oaks Rehabilitation Center in Concord, 96 cases at the Citadel in Salisbury, 14 cases at Grace Heights Health and Rehabilitation in Morganton, and 24 cases among 2 facilities in Union County. Now, when it comes to finding national numbers of nursing home outbreaks, it gets a lot more difficult. The federal government doesn't track them. The outbreaks have already claimed thousands of lives around the country, but experts say the lack of tracking and transparency has been a major blind spot. Nursing homes are naturally going to be more vulnerable because of a concentration of people in a high-risk group. But today we've learned there's actually a criminal investigation into nursing homes in Spain. Family members there claim their loved ones were left to die. The Spanish military found the bodies of some patients left inside abandoned nursing homes. The stress is only building for so many families as more people lose their jobs.
North Carolina's unemployment numbers came out today. Take a look, ratcheting the state's March unemployment rate to 4.4%, up from 3.6% the month before. Action 9's Jason Stujanki has been looking over the numbers today, really diving into what they mean for us. And Jason, this is just the beginning.
Yeah, and I know on the surface 4.4% doesn't sound that bad, but as we all know, it's really only part of the story. So here's what I want to do. I want to break down the numbers for you. I also want to talk about who's been hit the hardest and also about some help finally coming after a series of Action 9 investigations. So let's go ahead and kick it off. The numbers released today showed the number of people employed dropped 180,000 last month. That's more than the populations of Concord and Gastonia combined. So picture of both of those towns, all of their folks were out of work. And still, this doesn't paint the full picture. These numbers only went up to March 15th, and we all know how much has happened since then. So I expect the actual unemployment rate is much higher than 4.4% now. And we broke things down by job, and we could just tell that the things that we're all seeing here in our community are reflected in these numbers. Take a look at this. The biggest losses, leisure and hospitality services, more than 13,000 jobs lost. Of course, we've all seen so many restaurants and hotels close or cut back. Trade, transportation and utilities, professional and business services. And get this, education and health services, which of course may sound surprising, but keep in mind, schools are closed, and I've talked to many healthcare workers laid off as well.
But Jason, we know one of the biggest things you've been finding is people having a hard time filing for unemployment.
Yeah, well, of course, Allison, you hear about all these cases. It's not hard to see why, but more and more relief is on the way. I found out about some new details even this morning. The North Carolina Department of Commerce told me it's tripling staff to handle the claims. More than 1,600 workers, up from 500 before. And by the end of the week, it'll have another 600, it says. And those are private call center agents and another 100 from other state agencies, staff from those departments helping to soften the blow.
Jason, thank you. We know so many people need it, and we've been seeing many heartbreaking pictures across our community like this. People lining up in food banks just to feed their families. Hopefully, people can get back on their feet, and soon.
Inmates and prison staff tested after an outbreak at one prison in North Carolina, and listen to this, 98% of the newly tested people who came back positive weren't showing any symptoms. At least 149 inmates have tested positive at Noose Correctional in Wayne County, that's outside Raleigh. Wednesday, officials tested 300 inmates. Half came back positive. Again, 98% of them did not have any symptoms.
This is just not good or helpful information for prisons, but the wider public health community.
Yesterday, another 400 inmates and 250 staff members were tested to be on the safe side. Those results have not yet come back. The state is dealing with cases at other prisons as well. At least 30 staff members in 15 facilities have tested positive, and 281 offenders in 9 facilities have tested positive.
Hospitals are in desperate need of nurses. 3 weeks ago, we told you that some nursing students weren't sure if they'd be able to get the clinical hours they need to graduate. They had to have them.
Yeah, new tonight, our Gina Esposito learned the state nursing board is now allowing students to start working.
The North Carolina Board of Nursing says students will be able to graduate and get their temporary license so they can go straight to work. I spoke with one student here at CPCC who tells me she already has a job lined up.
This is what we signed up for. This is what we want to do. So having that opportunity to jump out there right away is amazing.
Elisa Brewer is a graduating nursing student at Central Piedmont Community College. While the campus has been quiet, Brewer has been online finishing required clinical work. Being able to complete that work was a big fear last month when nursing students statewide signed this petition asking to waive that requirement. Now the State Board of Nursing says students can graduate and get a nursing graduate or temporary license. That's allowing Brewer to start working at Atrium Health right after graduation, even though she hasn't taken the RN exam.
Even though we're able to jump out there like right away after we graduate, we're not going to be on our own. A lot of orientations, like for certain units, take 6 months to a year before they let a student be on their own.
Statewide, this is impacting more than 3,300 potential RN graduates and more than 800 licensed practical nurses. I'm told some testing sites are open if students want to take the test, but spots and resources are limited because of COVID-19.
A number of sheriff's offices are closed. We're not getting fingerprints. So at the time of application to take the NCLEX, you apply to the Board of Nursing, you apply to the testing center to get the NCLEX RN, and you also have fingerprinting done.
In total, there are 33 nursing students here at CPCC that are graduating in May. I checked in with UNC Charlotte. They have 67 students that will graduate. Back to you.